Hi everyone, Dr. Fink here, and today we'll talk about testosterone replacement therapy methods that minimize the infertility side effects or the risk of infertility in males. And we will go over three main medications, and I will show you the benefits and the downsides of each, and I hope this will be beneficial for you to make a good choice for testosterone replacement therapy in those patients who need it. So first, we have to make the difference between primary and secondary hypogonadism. Okay, so we have primary, which is basically a problem in the testes for the production of testosterone. You know, testosterone is produced in the testes. And then we have secondary hypogonadism, and here we have a problem in the regulation center in the brain, which is the hypothalamus and the pituitary gland. Depending on where the problem for our low testosterone lies, we have several options to counteract that. So if we are in the primary hypogonadism situation, this is the one where we don't have so many options. Here we need to replace testosterone from the outside. In the secondary, we can trigger or improve our own production with medications that mimic gonadotropin releasing hormones. I'll go over that in a second. So let's focus on patients with primary hypogonadism. Okay, let's assume the reason for the low testosterone lies in the testes, but they still want to have kids in the future, so they are worried about their fertility. So if they were to take testosterone cypionate or enanthate, a long-acting injectable testosterone, their sperm production would probably go way down and infertility would kick in quite fast. So this is not an option. So what would be a better option is short-acting testosterone preparations. And in the short-acting preparations, we have a topical cream, we have orals that work through the lymphatic system, and we have the nasal spray. And from the studies, from recent studies, it seems that the nasal spray has the least side effects on fertility in testosterone replacement therapy patients. And so for those, it would be recommendable to use the nasal spray, which is applied 2 to 3 times per day. And these short elevations of testosterone will most likely prevent a shutdown of your own production. Okay, so the nasal spray is probably the best option for primary hypogonadism. So for patients where the low testosterone comes from the testes. Let's say the problem of low testosterone comes from the hypothalamus and pituitary gland, so where the orders, the signals to produce testosterone are produced so that they can be sent to the testes for the actual testosterone production. Then we have different methods. Okay, so here in this hypothalamus pituitary complex, we basically release gonadotropin releasing hormones, and these comprise luteinizing hormone and follicle stimulating hormone. And this luteinizing hormone will basically inside of the testes produce testosterone. So we can actually increase or mimic luteinizing hormone, LH, by taking a substance called HCG, human chorionic gonadotropin. And this will most likely not shut down our own production. It will mimic the LH, so it will intensify the signal so that our testes produce more testosterone without having this elevated risk of infertility. That's for HCG. And we also have another medication called clomiphene, which is basically a selective estrogen receptor modulator. Okay, so it is selective estrogen receptor modulator, and what it does, it basically prevents estrogen to bind to the receptors, and this is basically leading to a lower estrogen level in our blood, and this is also sending a feedback to our hypothalamus, and by sensing, oh, there's too low estrogen, we increase our production of our endogenous testosterone production. Okay, so this is clomiphene. So we have for the secondary hypogonadism, for those who seek fertility, for those who seek to have children in the future, we have the options to not take testosterone, actual testosterone, but to improve our own production. And this is via HCG and clomiphene are very good methods for that. And again, if those don't work, it probably the problem lies within the testes and is primary hypogonadism, and then we need to rely on direct testosterone administration, and in this case nasal spray seems to have the lowest impact on fertility. Okay, so again, this is only for individuals who seek to have children in the future, and for those who don't seek that, there's different ways to do testosterone replacement therapy. I will do videos on that too, which are cheaper or easier to manage. I hope that was helpful, and let me know in the comments what you think.